In every community, health is the foundation of life. It determines how we live, how we work, and how we dream. At Asafo-Boakye Specialist Hospital, this foundation is being redefined, not just as a place of healing, but as a vision for a healthier Ghana. Asafo-Boakye Specialist Hospital was born from a simple but powerful mission: to bring world-class healthcare closer to the people who need it the most. With a commitment to excellence, compassion, and innovation, the hospital stands as a beacon of hope and healing.
Hi, my name is Louis Lamis. Join me on my journey through Asafo-Boakye Specialist Hospital. I am a regular at this hospital. Myself, my family, that is my kids and my wife. This is where we all come to whenever we need a medical attention. Today, I want you to join me on this journey to know why this place is not just a hospital. This place is more than a hospital. Let's go on a tour.
Behind every service at Asafo-Boakye Specialist Hospital is a dedicated team of professionals. From administrators to specialists, every member plays a vital role in ensuring that patients receive not only treatment, but also dignity, comfort, and trust. Quality is not a department. Here, it is culture. From the very first step inside, patients are welcomed with warmth and care. At the reception, every visitor is more than a name on a form. They are part of a family, and their healing journey begins the moment they arrive. Health is measured not only in numbers, but in attention and precision.
So far as we have your details on the system, anytime you come to the hospital, you are having everything to go. We just need your number to just open your folder. The doctor will have access to your folder, nurses, every department will have access to your folder. So this is the first entry point. So when you enter, you take a ticket to help with the queuing system. So you tap on this, and then you have your ticket. So when they are ready for you, your number will be displayed here, and then your number will also be mentioned by this monitor here. And then, as you can hear, it's going to say someone's number. That's not your number.
1, 2. Oh, it's not mine.
Growing up, I always wanted to be a physician. That's one thing. And then I went to Germany. I read tender age of about 23, and I got into medical school over there. So my whole training was in Germany. During the training, I came back to Ghana to do some of my clinical work. And then in coming back home, I saw the inadequacy of our healthcare system compared to where I trained. So I promised myself, when I'm able to complete my training and I'm able to make a little bit of money, I'll come back to establish an institution that everybody can be proud of. So probably that was my inspiration. Having trained in an advanced clinical setting and coming back home and seeing how inadequate our system is, I tried to set up something that we can at least try to bridge the difference between our public system right here and the setup in the advanced world. So that's probably what my inspiration was. Yeah.
Okay, so
let's just take a walk to the vital room.
Okay.
At Asafo-Boakye Specialist Hospital, vitals are carefully checked, ensuring that every consultation is built on accuracy, details, and personalized care.
Our cozy vital room.
Well, what happens here?
So after your registration, your name will be called. You come to this room, and then your vitals will be taken. So if I say vitals, your BP, your weight, your temp, your SpO2 all be taken. As I said, paperless hospital. Everything will be entered. This is for the baby. The babies are weighed in that.
Asafo-Boakye Specialist Hospital is a 100-bed capacity hospital. We normally say we are arguably the biggest private hospital in the country. What makes us unique is the combination of United States, Canada, and the United Kingdom healthcare technology. Basically, we try to be excellent. I always say what makes us stand out among the rest is the fact that here we pay attention to details. That's one key aspect that we do here. We pay maximum attention to details and proper time management, because all the causes of death in a hospital come from time. So we don't joke with time. We pay attention to details. We do proper time management. That's number one. Number two, we also try to make the place very, very clean. And so you come and meet a very clean environment.
We have 3 consulting rooms here, and for the first one is for the pregnant women, so ONG for the first one. The second one we do a mixture of ENT, orthopedic, physio, and then the first one is for strictly for the medical specialists. So we don't do just doctors, we do specialists.
Okay.
So I can take you to the first one to see the medical specialist.
Very well.
So he attends to you.
After you, please.
Okay.
The medical specialists take care of all the medical problems. Most of our patients come through that corridor. So when they get there, the doctor who examines them will be able to find out what kind of problem they bring. If it's a broken bone, then they refer to the doctor who takes care of that, who's an orthopedic surgeon. If the patient has problem with the ear, nose, and throat, which has been ongoing and chronic, then they know to send the patient to ENT. If the patient has problem with vision, they know and send the patient to the ophthalmology service. So we have services in the hospital. So anybody who comes through will be screened through the medical specialist. They take care of all the other problems except those specific specialties that we have specialists for. ENT is one. We have orthopedic services, gynecology. We have dental services, pediatrics, of course. But the pediatricians, most cases come to them direct. So the specialties, we have a lot of specialty services. But the medical specialty is the one that basically screens them and send them to where they're supposed to go.
So we don't just have 3 consulting rooms, we have a lot. We have close to, let's say, 15. Because of the number of clinics we run per day. Yes.
So where are the rest?
The rest, we have some downstairs. We have this close to the lab. And we have the rest down there. So when we get down, I'll let you know. So we're heading to the lab. This is our lab waiting area.
In the modern laboratory, science meet urgency with speed and accuracy, giving doctors the information they need to save lives and patients the confidence they deserve.
Ouch! It has pained me. Because I have kids, and I'll tell them not to cry, I won't cry. It's not even painful.
Yeah, typically when you go to most of the hospitals in Ghana, excuse me to say, as soon as you enter, you have a feel that you've come to a hospital. Why am I saying this? Because you enter, first of all, you may be embraced by, should I say, a very nice scent, which we normally call the hospital scent. You feel it, and then you see that, excuse me to say, most of the places are not organized. Even the things that they post on the walls for clients and staff to read are normally not organized, not clean, and they become dirty and those things. We decided to make the place a home. So as soon as you enter here, we don't want that feeling of the fact that I am in a hospital. That is something Dr. Boakye tried his utmost best to instill in us, that we should keep the place very clean. We should try to let the client feel that you have come to, let's say, a recreational center, a wellness center, not specifically a hospital, so that even if you are not all that sick, you can come and relax yourself here. And when you are relaxing in a place like this, excuse me to say, it's quite better than being in a hotel, because here every morning you are being checked upon, and then there are little vital statistics that we also take on the client just for you to feel at home. We provide you with meals, you have everything at your disposal, these DSTV services, you have an air conditioning room with wardrobe, with nice bed, and even if you have a friend or a visitor who you want to stay with, a provision is made for all those people. And that makes corporate managers, CEOs, all those big people, make it a fun to come to Asafo-Boakye for their weekend relaxation. As a matter of fact, most of the chief executives come on leave here. I've had a lot of CEOs who have come to spend 2 solid weeks here without being sick, because they think they relax here better.
Technology is at the heart of the hospital's care, from advanced scans to specialized diagnostics. Patients benefit from the very best of modern science.
Number one, I can say how clean the place is. Most of the places, especially Ghana Health Service institutions, they clean with Izar, and it has a very pungent smell. So the moment you enter the facility, you can smell it. And this is all across the board. Because Ghana has to provide these clean materials for them, and they all use the same. That's the first thing. We do our best to purchase clean materials from overseas in order to be able to make sure that this place stays clean. The washrooms, we make sure that, because this is a public place, you have a lot of people coming in and going. So we make sure that we have staff that takes care of the washrooms for us. So the first of all is our cleanliness. We make sure that the place is very clean. Number 2, we make sure our nurses know that they are here because of our patients. So when you come, either you come to work in the morning or at night, you have to stay awake for our patients. If they call you, you have to be there. They have problems, you try to solve it. If you can't solve it, you escalate it to the next level until you get to administrator, who basically knows what to do in this institution. So, and the third is our physicians. We make sure we employ well-qualified physicians to take care of our patients. So in this particular institution, we don't employ medical officers. Medical officers are physicians who come out after training, after doing the housemanship, which is now in Ghana is about 2 years, so they do 4 rotations. They are physicians, all right, but they don't have the experience. So we don't employ such people. And we don't employ physician assistants. So all our doctors over here are specialist doctors. That's why we call it a specialist hospital. So we want people who are well versed in the training, and so they can take care of our patients well. So that's our core mission, taking care of our patients.
At the pharmacy, healing continues beyond diagnosis. Medicines are made accessible, guidance is given, and patients leave empowered with the tools they need for their recovery.
Our medications are brought in directly by the owner, Dr. Boakye. Yes, he flies them directly himself. So him being a doctor, that's a plus to be able to choose the best medications. Yes, so they're very good in terms of quality. Okay, so from the pharmacy you're done.
So you pay
Before medication, yes.
Okay. Patients love our attention to details and proper time management. Patients really love that. The patients love the fact that they come here and meet their doctor. And patients love the fact that we have consistent doctors. We've kept our doctors for a very long time. And the patients love this place as a result of that. The patients love the place because our customer service is top notch. And as I indicated earlier on, we don't even do the customer service, it's customer experience. Our nurses are wonderful. Our other staff members are superb. We call every patient who comes to the hospital every day. If you are on admission and you are discharged, we will find out about how you are taking your medications, how you are faring, and if there is the need to even change some medication, because sometimes some of the medication gives some contra effects, and for that matter, the patient may not know. So we also aid them to talk to us whenever you come here and go home. And when they call on us that, oh, I'm taking this drug and this is the effect I'm having, we don't let you even come here. We pick your residential address and then our dispatch riders come to your aid. We don't do that internally. We even take medications to people in Accra, Sunyani, Takrade. We serve them a lot. And maybe let me also add, with this thing that we do, we also do proper home service work. And so we visit a lot of our clients in the house to care for them there, because somebody will just come in a month for just a refill. So we try to visit those people so that their coming to the hospital is shortened.
Hello, good morning. Please, I'm Jessica. I'm calling from Asafo-Boakye Specialist Hospital, Customer Care Unit. Yes, so Mommy, you came to the hospital yesterday. So we're calling to check up if everything went well. Okay, you didn't have any concern, issue with the service? Okay. How about suggestion to improve on our service? Okay. Okay. That's fine. Sure, we'll work on it immediately, Mommy. Okay, so if you need anything, any attention, any service care, you can call this number or send any WhatsApp, SMS, we'll respond. Okay, thank you very much. Okay, bye.
With programs like the Kids Health Fair, the hospital invests in the future, teaching children and families the importance of prevention, wellness, and healthy living.
Currently, we're trying to set up another one in Accra, which I'm really involved in. I think Kumasi, we have 100 bed, and for a private hospital with 100 bed, I think that's okay. I don't want to add more beds to it. So, for Kumasi, as far as expansion is concerned, I'm not sure I'll do anything dramatic in the following coming years. what I'm trying to do is set up a completely different one in Accra, a bigger one, and with more equipments and stuff like that. Because Accra is bigger than Kumasi, and population-wise, there are more healthcare facilities in Accra more than Kumasi. But I think we do a better job if we're in Accra, and we can attract patients from the sub-region. That's my goal here. But for Kumasi, at least, I think the next 4, 5 years, we will see. If we have to expand, we will. But at this point, I don't have any plans of expanding. If anything, I bring more equipments, new equipments, and the old ones. That's what we do every 3, 4 years. We replace the old equipments and put in new ones. We probably get an MRI and a CT scan. That's in the nearest future. That's what I'm looking at. But otherwise, all the other stuff, I think we are good. We will see which equipments we have to replace, which we will do. Yeah. Otherwise, Kumasi, I'm just looking at it and watching it closely. Yeah.
This hospital is more than a regular hospital. It is a promise. A promise that every life matters, that every patient deserves world-class care, and that Ghana's future can be healthier, stronger, and brighter. This is healing. This is hope. This is Asafo-Boakye Specialist Hospital.